Hello, everyone, and welcome to another episode of the Global P.A.D. Impact Awards. It is my privilege to present the Global P.A.D. Association's U.S. Wound Care Specialist of the Year Award. This honor recognizes exceptional innovation in wound care and education and practice, with a particular focus on vascular patients, especially P.A.D. patients. Peripheral artery disease patients, the ones with poor circulation in their leg arteries that, if left untreated, undiagnosed, untreated, can lead to amputation. This year's recipient, Anne Walsh, nurse practitioner, has transformed wound care treatment nationwide through her innovative approach to education. As creator of the Wound Care Pro app, Anne has democratized access to evidence based wound care information, particularly for diabetic and PAD related wounds. Her platform has empowered clinicians to deliver advanced treatments that were previously unknown and inaccessible to many patients, and combines technological information, technological innovation with compassionate care, particularly in her dedicated work with end of life wound management. In fact, her report that she did through the Global PAD Association on the Kennedy ulcer was in our top 10 for many months following, showing the interest and lack of information elsewhere about this end of life wound care issue and management. Her educational video seminars consistently, though, rank among providers and just exemplifies how clinical excellence paired with innovative education can just elevate the entire field of wound care, ultimately improving outcomes for patients with complex vascular wounds. So, without further ado, after that really long soliloquy, as I gush over Anne Walsh, nurse practitioner, because we appreciate her dedication to saving life and limb, please join me in welcoming our U.S. Wound Care Specialist of the Year, nurse practitioner Anne Walsh.
Thank you so much for having me and this honor, this award. It's incredible. Thank you very much.
So I'm curious, I want to go way back because the patients that tune in really like to understand what got you into this specialty. So you got into becoming a nurse practitioner. Tell us what inspired that, and then how you found the defining moment in which you found wound care to be your ultimate passion.
Well, my second degree was nursing. First, I was in finance, the finance world, and it wasn't me. So I went back to school. I was working in a nursing home as I was getting that degree, and I was around nurses. And I said, "Oh, this is more in line with my liking." So I went back to school, became a nurse, and I loved home care. And as I was seeing patients in their homes, sometimes in some underserved areas, I was seeing all these wounds, and I didn't have that knowledge from nursing school. So I was blessed to have a specialist, a clinical nurse specialist, who took me under her wing, taught me, and eventually the agency sent me to Emory, and I was educated in wound care. And and then I'm seeing what needs to be done. And if I'm a nurse and I can't write the orders, then it could be frustrating. So I went back to school to become a nurse practitioner, so I could actually give the orders for what I knew the patient may need. So it's all just tied together. And all these years later, I still see the lack of wound care education for nurses and physicians, and it's just such a need. Patients are, coming to us more complex in the home care setting, and it can be overwhelming for clinicians if they don't have the tools at their fingertips.
How is it in 2025 that our wound care isn't more advanced than it is? Because we're seeing it across the country that our patients really struggle. I just had a call on our Leg Saver hotline yesterday with a patient, PAD patient, already lost one leg. The wound ended up becoming septic. He has another wound on the other leg. He seems to have enough blood flow, right, going down, but he's on a lot of blood thinners. He's definitely susceptible to wounds, and wounds that are tough to heal even with the blood flow. And he can't get in a timely fashion to his wound care center. And it's very frustrating for him. And even recently, before the show, I was telling you about Jay, who's now on our board of directors for the Global PAD Association, whose mom couldn't get the wound care at home that she needed, and the daughter ended up inventing something on her own to be
Wow.
able to manage the wound. Why is this necessary in today's what's happening in Is there a light at the end of the tunnel at this point?
Yeah, I mean, I hope so. I think a lot of education is needed for sure, and even to empower patients to, have how to take care of their feet, how to, lifestyle modifications that hopefully can prevent getting to the wound. And once the wound occurs, getting the services that they need by education, more clinicians, because there is a shortage of wound care clinicians, across the board. And you mentioned when I help patients with advanced disease, there's a shortage of palliative care, physicians and clinicians as well. So it's, to get more people educated and to
Mhm.
empower the patients themselves, what they can do upstream, hopefully to prevent some of these complications. And once they happen, to have a clinician at their fingertips that knows what they're doing, or at least could refer them to the right people.
I would imagine it's so hard with that shortage, especially for the patients that don't have the transportation. They can't get to the wound care center all the time. They need to have a home care
Right.
nurse or nurse practitioner to take care of their wound. And that nurse or nurse practitioner can only come a couple times a week because they're so bogged down with so many patients. And then the patient's wounds end up wrapped too long. We had a patient in Michigan who ended up with, she called our Leg Saver hotline and said, Kim, I can't get a hold of my nurse. I feel like there's something moving inside my
Oh,
wrap. And I said, I know exactly what that is. I
yeah.
said, "Don't pass go, get to the hospital now." And lo and behold, what do you think was in there?
Yeah, maggots. Yes, we've seen it, especially the summer months. Absolutely.
And that's really scary, especially in those really warm areas, muggy areas. Um, that's why I'm wondering, I mean, with your wound care app, Wound Care Pro, I'm sure that this specific situation is really why you developed this. You saw this need. You wanted to get the information out there to democratize access to all nurses, all nurse practitioners, all doctors that are out there, even if they weren't wound care specialists, so that they would have access to the most updated evidence based information at their fingertips when they needed it.
Absolutely. And with the telehealth now is a way, like, the agency I work for, I'm getting 20 to 30 consults a day. So I could see pictures, I could do video visits to reach a lot more people. And then if somebody's, more complex needs and they need in person, maybe bedside debridement, or I also, help patients with ostomies and fistulas, and that's more hands-on, then I'll go there. But like you said, you can't see everybody, and there's only a few of us wound specialized people out there. So to empower the nurses to be there to give them the tools, and then to help, when it's more complicated and, outside of their, scope or whatever.
Is there any situation that really stands out when it comes to those who have downloaded your app that it helped in specific situations, that you have a story that someone reached out to you and said, "Oh my God, if I did not have this, I wouldn't have been able to treat this patient. But because you did, because you created this app, I was able to get the right information, treat the patient correctly, and wow, we saved a leg."
Yeah, it's interesting. I'll get, if for some reason there's a glitch with the app, I'm updating it, and then people are going crazy. Like they're like, I don't realize how much I depended on this. I'm like, wow, okay, give it a second because it was updated to the
Yeah.
next level, I-16 or whatever. And that's when and that the person was like, oh my God, I'm so reliant on this that it's just they can't live without it. And I've had others, just looking for validation. They said, I was looking at your app, I have the skin tear, I'm thinking of using this, or malignant wounds, I'm thinking of using this, or vascular wound. Um, and I said, yeah, absolutely. So they just needed validation, and then they take it on their own. And I've had other nurses who were doing wound care, but not so much palliative wound care. And when they were in that arena, they were just like, how do I, navigate this? And until they got more comfortable, they would reach out to me and say, based on your app, is this correct what I'm thinking? And take it from there to help somebody who's bleeding, or, an malodorous wound, that sort of a thing.
Talk about a case that other clinicians and physicians could learn from, that you learned a valuable lesson. It could have been a success, could have been a failure, doesn't matter. We've had both expressed in this series. We ask this of all of our award winners. And I mean, that you think that you should share that in this moment, if someone watched this one video clip of you sharing this story of a lesson you learned, what would they learn?
Well,
Bring
I
me
just
back to
think,
that moment.
yeah, I think working for hospice and palliative care now, after being, in regular home care for many, many years, even I sometimes are thinking, okay, this person may not heal. And then I'm like, I'm astounded that the healing does happen in some, patients against all odds. I think of one lady who was in her 80s, retired nurse, came to us with a stage 4 pressure injury on her sacral area. She had diabetes as well, and the bone was exposed. She had a tracheostomy, feeding tube, with the whole gamut, and just had one relative out of town as well. We'll do the best we can. Um, bring all services in to, get the diabetes under control and whatever we could do, within reason for the patient. And she went on to heal completely and was actually taken off hospice because the stage 4 healed. She was able to, the vent was stopped, it was like all these chronic issues, but not appropriate for hospice at the time. And I also think of another patient who had diabetes and vascular wounds and a pressure injury on her heel. And we were sort of, treating it palliatively at first, and then the S-score lifted off on its own. There was an odor, so we became more aggressive. She went on to heal. So I have, when I do presentations, I show these patients case studies because it's like, wow, you just never know the healing that goes on. So that's why when I do presentations, I said to heal or palliate, because sometimes we may go in, and if it's, the person's end stage and there's a malignant wound or can be terminal, so we may know, okay, we won't be able to heal this person, but it's a lot we can do. Let's get the pain under control, the odor, the bleeding. Other patients are like, I'm not sure. Let's hope for the best, prepare for the worst, and the person heals. And it's so satisfying for everybody.
I'd be curious, just because we're on the topic and you're talking about specific situations, that we have had a couple of situations lately where the patient has ended up with these reperfusion blisters where their foot, after they end up with this gush of blood flow after having next to none for so long, they reperfuse, the blood flow gets down there, it's whooshing into the foot, and suddenly the foot just breaks out in these really painful blisters. Have you seen that?
I've seen, some patients get what they call bullous pemphigoid, and then these giant blisters, and we treat those sometimes with topical steroids. They go away, so it's more of an autoimmune thing. So I don't know that I've necessarily seen that firsthand.
Could be. It was one of I had never seen it before, and then when I had that happen, another doctor told me that the similar thing happened when a patient had a deep vein arterialization, where they go in and hijack the vein in the calf and they reroute blood flow through the vein into the foot, and suddenly the foot's just populated with, blisters afterwards that,
Okay.
in both cases, they were able to properly treat them and they went away, but, um, they
Interesting though, yeah.
mentioned that. What?
I said very interesting though, but I guess they know and they'll prepare them. This may happen.
I they I, it seemed to come as a surprise, to them that this was occurring, but they did relate it to that. It was, quite the coincidence, right? If not, but
Yeah, yeah.
they were able to take care of it, and it would be interesting to look into. I just thought it was interesting just because I'd never seen it before, and then I hear it's happened twice just in a matter of a week,
Oh, interesting. I'll have
so
to
in
look
two
into it.
different cases.
Yeah.
So just would be curious if there was some sort of direct correlation. Um, Tell me about a patient that literally you were impressed with, who was able to. People had pretty much given up hope on this patient, but through their own perseverance, they did everything they were supposed to do. They even may have been creative in their own right, that they were able to heal and move forward with their lives.
Yeah, I mean, think of a gentleman many years ago that had a diabetic foot ulcer for years, but he was always walking on it, and it took him a while before he was ready to consider, or total total contact cast, so that he could still ambulate, so to speak, but he's not putting direct pressure on the wound,
Mhm.
and it went on to heal. And he was just like, oh my God, I was living with this all this time, not realizing, and also seeing the result of his trying to get his sugar under control a little bit more.
Yeah.
But he was sort of thinking, I'm stuck with this, and that was it. But just to see that transformation was amazing.
Yeah, I always love those stories.
Yeah.
And another question, we usually ask people about, to give the best motivational speech for walking at this point in the interview. But I think a better question for you is about how do you guide these patients with wounds who are peripheral artery disease patients, poor circulation, right? They need to move. They're supposed to walk. Walking's the best medicine, but they have a wound. They're told that they need to offload, that they need to try not to walk as much as possible, unless they need to. How do you guide them on doing exercises, for example, to improve circulation, like spreading their toes, pushing an accelerator button, drawing the alphabet? What is your best guidance for these patients?
Yeah, a lot of times we have a team approach. We have physical therapy in there, OT, the home health aide. So I think it takes a village. So reinforcing what they can do if they're sitting
Mhm,
down and almost if they're pushing a foot on a brake or something, just to like get the blood flow and that sort of thing, and then getting the medical intervention if there's any kind of medications they may need or whatever.
mhm.
So I think it just takes a village, and we have a pharmacy that'll deliver to them, so it's not an excuse. Oh, we ran out of medicine. We got you. So I just think any hurdle they may have, we could hopefully help ease the burden a little bit.
Yeah, and I think that's so important. Now, for you, what was the most defining moment in your career? That aha moment, the 6 minutes that mattered. It could have been a mentor you talked to, a conversation you had with them. It could have been a documentary you watched. It could have been a patient encounter. What were the 6 minutes that mattered in your career? The most defining moment for you?
I guess it would, I've been working in home care for so many years, and I just remember hearing about palliative care, and I didn't even know what it was. And then our hospice department sort of needed more assistance with wound care. So I started doing 1 day a week with them. And then I became like, oh, wow, I could do this. And just, I think, just learning that not to be afraid of somebody with advanced illness, and, that there is a lot we can do. And I think so many people are, afraid of it, so to speak, and don't want to talk about it, whatever. But I just think, just being there for them. And there is, when it comes to wound care, a lot that can be done. And like I said, I'm even shocked how much healing goes on. And sometimes these patients come off of hospice. So it just, to go in there with a positive attitude, and there's something we could do, whether it's healing or palliation. I think that was a defining moment for me. That's what got me into palliative care and hospice.
I love that. I love that you have so much hope. And we always tell patients that, not to define themselves by their disease, not to define themselves by how the doctor defines them. For example, palliative or on hospice, we hear it all the time, especially in the UK, that so many of our patients get placed on palliative care. And then that limits their ability to seek more advanced treatment. For example, we had a patient that was a cancer patient, and since he was placed on palliative care, marked terminal for his cancer, the vascular surgeons refused to treat his legs. It's something they are addressing. It's not something that is a systemic issue across the entire UK, because there are doctors that will do it, will treat. But in this particular situation, under there's this one system, the patient literally ended up ultimately dying from CLI, from sepsis, from the wounds. They would not treat, they wouldn't help his pain, nothing. It was literally surprising. And
Yeah.
so you ask any other doctors here, you ask, a couple other doctors in the UK that are in different situations with um, centers of excellence for critical ischemia, and they say, "Oh no, we just want to we need to make patients comfortable, and there are ways in which they can do that." Um, but there are a lot of things when it comes to PAD, and that do you find that the medication, the typical medication, doesn't cut it? That you have to maybe go after the sympathetic nerve in order to make them comfortable?
Well, yeah, if somebody's on palliative here in the US anyway, they could still get, curative treatment, so to speak, all along the
Yeah.
way. It just, you're bringing another team in, because we even have a friend who her sister's in the hospital, and hopefully to get better. I don't know. It's a head and neck cancer, and I said to her, call in the palliative care team, because she was saying I don't think the pain's managed or whatever. And I said to her, it's not hospice. We're not saying we're giving up on your sister. We're just saying bring another team in. They could see what's going on, help navigate the hospital system with you, which is complex, and support you and the rest of your family, and go for the treatment, whatever the sister wants to go for, if she can, tolerate it. Whereas if you go to hospice, then a lot of times there isn't necessarily that aggressive thing, but if the patient wants it, okay, we support you. They may come off hospice, go for that procedure, and then come back to us. Because sometimes we'll see like one patient had complete gangrene and it was a podiatrist and they were applying oxygen therapy. So then to come to hospital, we're like, we don't see that that's going to help that gangrenous foot. It's complete gangrene
Yeah.
at this point. So but the patient wanted to try it. Hey, all for it. So we got them on the regular home care. Let the podiatrist work with the person. Miracles happen, and then they can have palliative care, whatever they want, and then when they're ready, come back to hospice. So I think it's a lot of misconceptions out there. I've had even other wound people saying, "Why are you giving them antibiotics? They're on hospice." Of course, if the foot's infected, we're going to give them antibiotics if the person's able to tolerate it. So I think we manage symptoms very aggressively depending on how the person is, even on hospice.
What is that case that still keeps you awake at night? Something that just you feel still haunts you to this day that you're just like, oh my gosh, I wish I could have done more.
I mean, yeah, I don't know if there's more. I could have done more. There's one particular lady I always think of, and she had, round the clock care, private hire, the husband, sparing no expense. And every time I went there was a new wound. And it was just like, oh my God, this poor lady, the shoulders, the hips, the sacral. Talk about kidney terminals, or it's end of life, a skin organ failure.
Yeah.
And the aide had said to the husband, don't give her morphine. She doesn't need that. And it was just like every time I went in, I'm like, you kidding me? This poor lady. But so there was just like ignorance, and it was just disturbing to see her suffer. While I'm there, can we give her a little bit of morphine, please? Tylenol's not cutting it as we're turning her and doing all this wound care. So I just, that is just stuck in my mind because like that poor lady is suffering because somebody's telling him not to, that has misconception in their mind. But she had, like I said, multiple wounds and somebody was cared for. So it was not for lack of caring. And it just, I was glad when I was there. He's like, okay, as soon as I left, she wasn't gonna like he was listening to her and he wasn't gonna give his wife the medication she needed. So it's
Oh,
I know. It's just like, ugh.
that would,
But
I just don't like seeing anyone in pain. I get so
exactly.
frustrated because I know that there's a problem in this country with addiction to pain medications and things like that. But there are people out there are patients out there that are suffering so much and they can't get anything. They're not looking to become, pop pills.
Right.
They just need something to get by until that wound's healed and until they can get that insurance to approve some sort of care. So many delays and denials are just driving me crazy in this space. But the patients just need a little help. They need
Absolutely.
this some pain relief. And there's nothing we can do except talk to them, hopefully, maybe distract them just a little bit, just to help them get by. But, the people that are, crunching numbers don't understand the pain that goes along with, these wounds.
Yeah, absolutely. Absolutely. And just there's always something to be get done. And if it does include opioids, as long as it's done safely, because a lot of times it's not necessarily the patient, maybe other people coming in the home, you have to do it safely because we know it's a problem in society. But oftentimes there's other, TENS treatment or hot or cold or, lighter, there's different other options that can be utilized as well. But if it's severe malignant pain, you got to step it up and, give the person what they need.
Oh, and if their tissue is dying and they're waiting for a procedure, oh my gosh, most of the medication doesn't even cut it anyway.
Right.
I mean,
Yeah.
it's just tears me
I
apart
know.
because
It's true.
I just want to help them. I just want to
Yes.
relieve their pain, do something, create magic, wave my magic wand.
Yes.
So with your app, what is the most popular, most looked at section on your app? Is there a one particular study that people look at, one particular area of interest that seems to just be the most popular, which maybe demonstrates a real gap in education that's out there widely?
Yeah, I mean, I would say pressure injuries because it just, as people are becoming more frail or, just they're not eating, there are a lot of comorbidities, their skin may break down. And I think it's just very distressing to family. So they need a clinician to go in and say, okay, let's get that special mattress on the bed. Let's teach you how to turn the person. And I even have a video in the app to show, it's a 2 minute to show how to turn the person because sometimes people don't even know that. And they're
Yep.
putting the person on their side and the person's like staring at a wall but rather than 30-degree angle. So it just and lots of lawsuits. I do as expert witness, I'm getting flooded with cases because pressure injuries happened and just ongoing education is needed. And sometimes it happens against all odds. Like I said, with the skin breakdown at the end of life,
Yeah.
if the heart's failing, the lungs are failing, the skin's going to fail too. But it's visual, so we see it and it's disturbing if we don't know what's happening.
We see it a lot with our PAD patients. I just had a doctor tell me about a case where he was able to save this patient's, limb and save their life. And then the next thing you know, they look over and there's a pressure wound underneath the heel from laying there in
Right.
bed. And he was like, "Oh my God, I don't know. We have a whole new, protocol for preventing these things." But man, that was just it was almost like just took the wind out of their sails to have to go bring them back to the OR at that point and do debridement, whatever they had to do. But that happens a lot. What can families do to help prevent this, to aid the hospital staff in
I mean, sometimes
preventing
it's
these?
yeah, it's as simple as floating the heel off the surface. Like, say somebody goes in for a hip replacement, and wow, you did great at the surgery. Next thing you have a heel pressure injury, and if they have poor circulation, things could get bad pretty quickly. So just having it doesn't have to be elevated, but just floated off the surface. And now a lot of the new beds have the foot of the bed sort of deflated a little bit, so it sort of keeps a little pressure off. But the special booties they could wear and just like getting that heel floated off the surface is key.
And I know you have a time crunch today, so I have one final question
Oh,
for you.
sure.
It's a fun one. It is one that the patients came up with. It's not to mock the patients, and I have to do the disclaimer every time because of a recent viral TikTok video where a gynecology team ended up making fun of the fluid on papers after female um, consults, and
Oh,
it was really disturbing. So this is not that. This is literally patients want to learn what they should and shouldn't do and shouldn't say. And we've had, for example, Dr. David Alper, who talked about a patient who was a diabetic and they couldn't keep their socks up. They tried super glue and then they progressed when that didn't work
oh,
to rubber bands and that didn't work. So they decided to staple the socks to the skin.
wow.
And you know where that went.
Yeah.
Major infection. Didn't hurt them because they have neuropathy, but that was one issue that I saw. Another one was someone with diabetic neuropathy, Dr. David Armstrong, whom you know as well. He was sharing the story that patients sometimes with diabetic neuropathy um, don't realize they really need to keep that foot covered, especially if they have animals around. And the dog ate a patient's toe.
Oh my gosh.
Yep.
Wow.
So we've
Wow.
had some pretty good
Yeah.
lessons, that people could learn from. So I didn't know if you had anything. We also have, some patients in the Philippines that were using bleach
Oh,
to
wow.
clean their wounds.
Yeah. No, I mean,
So
sometimes I'll see people using, some homeopathic stuff, which sometimes seems to work. We had a patient one time with a heel pressure injury, poor circulation, the whole 9 yards, and they were using turmeric right on the area. But it's like it's not going to hurt, because the wound um, it wasn't, it was a small wound at this time and clean, but it's supposed to decrease the inflammation. So sometimes using it, and I said we could try it because you want to open up to let you're going into their home, and see how it does. And then after a while, it was getting overly dry. All right, let's stop that and switch to something else. But sometimes just sort of being open-minded when people, whether from the islands or wherever, that you want to use aloe and you want to use some of these things that listen to that. It's been around forever, and like we could try it as long as it's not putting that on gangrene and making that moist and you know get it to convert it from dry gangrene to wet gangrene. Then that's all right. So just like homeopathic stuff is like, oh, interesting, But
well, that leads me to a question. So that wasn't really my final question then. This
uh,
is possibly Manuka honey. So we've had it floating around that Manuka honey is great for wound healing. But I was under the impression it's the medicinal, so you get the medicinal version of it, right? W I've heard of people actually just buying it off the store shelves or off Amazon, just buying New Zealand Manuka honey. Is that the same thing?
The honey that we get from the companies that have made it, it's sterilized, it's, made for wounds. I don't know, like getting it just over the counter, honey would do the trick. I'm not sure if it, might be more of a risk of infection, but we do see wonders with the different honey products out there. Especially if it's a small arterial ulcer. I see a lot of times like a punched out appearance on the ankle, maybe a little yellow slough tissue. And every time I see those, I'm like, honey, so we put a little honey gel on there and protect the peri wound and, abdominal pad and a gauze wrap twice a week because it works up to 7 days. And I see the healing happening quite often. So and it decreases the inflammation. So it even helps with the pain management a little bit.
But it's not off the store shelves.
But it's
This
not
is
off the
something
store
you
shelves.
talk to your
So it's sort
doctor
of,
about.
yeah, yeah.
Yeah.
It's like when you think
Okay.
about the wound centers that do maggot therapy, these are like
Yeah.
sterilized maggots. You're not just getting a fly, putting it on your wound. And, so yeah.
You know, I did have a patient's wife that was ready to go find some roadkill.
Oh,
She learned about maggots. The patient's doctor would not prescribe them. She was determined. She came to us. We knew of a doctor that does prescribe maggots. And if she was hell bent on going after roadkill
wow.
to get a fly,
Yeah.
then I was going to do whatever I could to prevent that from happening. So we were able to introduce her to a doctor that did decide that and determined that it was appropriate for her. And we were able to go through a special place
Mm.
to get the maggots and hire a nurse practitioner who knew how to
Mm.
put them in and remove them safely afterwards. And it worked. It was
Oh,
great.
yeah.
I'm surprised that more wound care centers don't use it because it literally, I've never seen a wound look more squeaky clean than after the
I,
maggots.
Yeah, I've seen that. I've seen where somebody will ask me to go in to debride a wound that's full of yellow slough tissue. And by the time I get there, unravel the leg. I'm like, oh my God, I see the maggots, but the wound is sparkling clean. Rinse them out. And it's like, you don't need any more debridement. You're done. It's so they actually do, in a sense. But I wouldn't go looking for them, but they do clean up the wound.
That is
Mm.
that's a good lesson. Do not go looking for roadkill. But it also raises a really important point that if you do have a wound, you do need to make sure that you're following doctor's orders and
Right.
nurse orders to keep it covered, keep it protected, keep the windows closed.
Right. Exactly. Exactly. Because those flies get in there somehow.
Somehow, I mean, this wound was wrapped. I
Right.
mean, how in the world? It's just
It's
crazy
amazing.
how they get in there.
It's
Sneaky
amazing.
little buggers. Well,
Absolutely.
thank you so much, nurse practitioner Anne Walsh, our Wound Care Specialist of the Year award winner. Thank you for all you do to save life and limb.
Thank you very much for having me.